we see results,
Mm-hmm.
We really see that giving young people agency, that believing in them, that thinking that they are the experts of their own lives does have a lot of power in it.
What can we learn from youth and youth workers? How can we support each other and become a better version of ourselves? This is the Source of Growth podcast, created by a Hungarian NGO, the Academy of Experience. I am Arpad Barnai, the host of the podcast. This is the second episode of our conversation with Johanna Kronstedt from Sekasin Chat. As the importance of mental health and suicide prevention becomes more and more an important topic generally, it is covered more not only in the field of professionals directly involved in mental health, but in other fields as well, where non-therapeutic providers, other safe adults are present for young people. Youth workers, coaches, teachers, family members can create a stronger safety net, a support system for youth. This episode covers topics that can contribute to that. We talk about the role of meaning and purpose, about what solution-focused approach means, how to close a conversation about suicide, and signs for when to be worried and when not. Johanna shares tips about what kind of small steps of support could be offered to someone in a suicidal crisis. I found talking to Johanna very educative and inspiring, very useful, for me at least, and I hope it helps you support young people around you better and with more confidence too.
How do you find meaning in life? And that's a very fundamental question, because a lot of people that are suicidal are also depressed. And a lot of depression comes from feeling that life is meaningless. Why are we here on earth? What's the meaning of my life? I have nothing to give to anybody. I'm always in a bad mood, and everybody I'm just a burden to everybody. Okay, this is a quite common narrative for people that are suicidal. So what I'd like to focus on is finding meaning.
Mm-hmm.
And you can do that in many different ways, in very creative ways. Because I'm solution focused, I like the miracle question. This is not really the miracle question, but adopted. It's like, if you could do anything, if the world was your oyster and you could do anything you want in your life,
Mm-hmm.
what would that be? Sometimes, these people, they surprise me, and they're like, well, I would be a social worker, or I would go to Africa and I would take care of the lions, or something. Like, for them, that has sounded like this is utopia. I could never do this. So that they haven't gotten any hope from that, but they say it out loud. And I say, why not? If that is something that would bring meaning into your life, if that is something, if all hope is gone and you have nothing to lose anymore, try that before you try to take your life. Try pursuing exactly that. What would be the first step? Opening up the mind to the possibility that my life could look more like the life I wanted to live. I think that is one way to bring hope into suicidal people.
It's two things at the same time, because you help me with just aiming for what I really, really want and forgetting for a while about what's possible or what not. What would I find meaningful or important in my life? Oh, I would love that. I know it's impossible, but I would really love that. So it's something important. And the other thing is that it can be seen, at least, something really far away. So with the end in mind, we talk about small steps, small signs of progress. Yeah, especially if someone is depressed or don't feel that much energy or capacity to do stuff, expecting to do a lot is too much.
Yeah.
It's something I really like about solution-focused approach a lot, that you have these two at the same time, which might sound controversial, but it's not actually, because I want to go there and let's start in small scale.
Baby steps.
Yeah, baby steps. I wanted to ask, how did you end up working solution focused? Why I ask these questions, how does this great thing you all do end up using solution focus? Sometimes I meet people who have the misconception that it's also some kind of toxic positivity, everything's fine kind of approach. And it's apparently not. What would you say about this?
First of all, I would say I understand it. I understand where the misconception comes from. if you only have the surface understanding of solution focused therapy, it is very easy to understand why you get the feeling that it's just happy, happy, joy, joy, because one of the things with solution focused therapy is that it came as a reaction to other forms of therapy where the focus was on the problem and in some ways so heavily on the problem that there wasn't any time or space for the solutions. And that's the background of solution focused therapy. They were like in the 70s, the 80s, they were like, let's just blow this therapy field up and do it differently. And in the beginning, it was very radical. Personally, I'm a very active person. If a problem comes along, the thing that is most anxiety provoking to me is to do nothing. That is the worst thing that could happen to me. Like, I need to be active. I need to search for solutions because that makes me feel that I have some sense of control. I have agency. So that's the personal reason why this was the therapy field that I wanted to study. And one of the persons, like my boss, my highest boss, who actually was part of starting this service, this Sekasin Chat, is also a solution focused therapist. So I think she has influenced it a lot that this is the way we should approach our youth. But it's not only that. We see results.
Mm-hmm.
We really see that giving young people agency, that believing in them, that thinking that they are the experts of their own lives does have a lot of power in it. Mm-hmm. We empower young people by doing that. And by the way, solution focused does not mean let's ignore the problem. Solution focused means listen to the problem, analyze the problem, know what the problem is so that you will have the best answer possible to find the solution. The focus is on the solution because you can talk and talk and talk about your problem. For some people, it helps. For some people, that helps to just get that catharsis, get it out many times and focusing on it meticulously. I'm not taking that away. I'm saying it has a place in the therapy field, obviously, of course. But for many people, once you've talked about it enough times, you get stuck. Mm-hmm. And that's not very hopeful. That doesn't get you as far as you could go.
It's very interesting what you say. It's related to listening, really, because if you don't feel that I really heard what's concerning you, what's your problem, but I just want to quickly move on to let's solve this, but you don't have the sense of this person that I reached out to really gets that this is tough. So this kind of normalizing my response, or maybe feeling unable to do anything or having dark thoughts, has a very strong part in connection. And then also not getting stuck there, but really moving forward together. That's a big thing. Okay, we're gonna explore later in different conversations, maybe this, because I have some other solution-focused people also on the list of guests.
Nice, I'm happy.
And the question is that, okay, if I hear someone talking about suicide with these guidelines, I really like your guidelines. Like, okay, it's not that you should say exactly this, but you should go for hope and meaning and believing the person. And also, I hear sometimes in Hungary, at least, it's a very common phrase. Like I hear from people that they say, "Oh, they just want attention," so they don't think it's not serious. They just want to bring attention to themselves. So what would you say to that?
I would say I understand that. I would say that can be part of the truth, but usually that's not the whole truth. And usually that's not even the biggest part of the truth. That's a small part of the truth. I think some young people have found that people take them seriously and give them attention if they say this out loud. So in that way, yes, they use their suicidal thoughts to get attention, but that does not mean that they don't have suicidal thoughts. So don't dismiss it. The absolutely biggest part of people who have the courage to say, I have suicidal thoughts, do not do it to get attention. On the contrary, they have kept all of their pain in their heart and for themselves for such a long time because they haven't wanted to get any attention, that it has gotten so bad that they feel suicidal. So don't ever dismiss hearing these words. That's what I would say.
Yeah, thank you for this. Thank you. Really, it's nice to have this kind of summary about this. Hard to find words when I hear these sentences. The other thing that came to my mind when I heard you speaking about this, that the circumstances behind suicidal thoughts and behavior are related to abuse, trauma, any other like this kind of situation. It already has a lot of secrecy, a lot of silencing and shame for the victim or someone who is surviving that situation. And opening up is not easy at all about that situation, and also about having suicidal thoughts. That's the same category. So actually wanting attention is already part of the solution. So that's they are looking for something that they believe a bit might help.
Exactly.
Like that's why I keep coming back to your volunteers, because I think you practice this a lot. You're an expert in this field, but still you train volunteers. And most people who meet these kind of situations are on the level of your volunteers regarding experience. Like they don't meet this situation quite a lot of time. What would you say to them? How to end these conversations? Because there's some kind of element of doubt that, okay, should I worry? Should I not? Signs of risk, signs of safety. So closing a conversation, what would you say to that?
I don't know in Hungary what kind of medical help and psychological help you have available for people who have suicidal thoughts. But at least in Finland, there's psychiatric help, there's psychological help, there's medical help. Granted, the resources are not as big as they should be, but there is professional help to get. And I would say if you encounter a person who is suicidal, who has suicidal thoughts, it would be in their best interest and it would be very good for them to get professional help. What that is it therapy? Is it medicine? Is it both? Is it a counselor for a longer time? Is it a peer group where they can discuss things? Is it the strong social help from their family and friends and relatives? It depends. It really depends on the person and the situation. If you have this discussion and if somebody has believed in you enough to tell you about this, don't leave them alone with it. Like you don't have to say, I'm going to solve anything. I'm going to solve everything. You can't give that. You can't give false hope and you can't give false promises. But what you can do is you can say, I can connect you with a person who can help you. Like, for example, you know, somebody, a youth worker, somebody who has maybe a little bit better relationships and knowledge about where the next step would go. But don't leave that person alone and thank them for trusting in you. You know, that's very important. Call them brave, call them wonderful. Be really, really happy and thankful for having that kind of trust. And your way of showing your support, it is dependent on what you can give, but you can always give something, you know. This was very vague, but maybe you got.
I like these things you mentioned, that this kind of solution focused and resource focused approach can help you appreciate the steps they've taken. They might be small steps, maybe just sharing stuff or just maybe reaching out to someone. And if you really pay attention, then you can see that it's a huge step. Or just coping with unbearable stuff in their lives. They hang in there in spite of it being super hard. And if it's not appreciated and not acknowledged that you are fighting hard or you are holding it together in spite of all the circumstances, no one says to them, because they don't speak about this stuff. So that's a big thing that you just shared. The question is like, okay, you say, I can ask as a youth worker, like, are you okay with me connecting you with someone else? Do you want to help? Other help than this conversation. So that would be one way around this. And if I know about some available services, then I can propose that. What would you say when should I be not so worried at the end of a conversation about suicide? I can still, I don't know, sleep well, and it's not that serious. So, yeah, we might talk next time, or the person will reach out to a service.
That's a hard one. Well, if the person that tells you about their suicidal thoughts, if that person has told anybody else, that's always a good thing. If that person has already professional help, super. You can always ask also. I like asking. I like asking, how worried should I be about you? Usually I get a very, very honest answer. Well, actually, you should be quite worried. Another way of asking that is, how worried are you about yourself? Usually it's quite honest, that answer too. And if that other person says, no, it's really hard right now, it's tough, but I'm not going to hurt myself, tonight, or I'm not going to hurt myself, I couldn't do that because of my mother or because of my family or my spouse or whatever. And also, listen to your intuition. If your intuition says that the person is saying one thing, that no, I'm okay, but you don't really know, should you trust it or not, go with that. Always go with that. Something that's really important also is that if a person is suicidal, their amount of energy to themselves get help and support is very limited. So even if they would be motivated for that, they maybe don't just have the energy to go online and see what services, where should I go, who should I call, who should I meet, does it cost, and so on and so on. So if you're the one hearing this, you can, and you probably should, say, hey, I understand that your mental energy right now is very limited. So what if I would come up with a couple of services that could help you? Would you be open to just like thinking about these as an alternative? And then, every person has, especially if we're talking about young adults and adults, they have a responsibility over their own lives. We cannot decide, we cannot take a person and say, I will fix you, and take it to whatever services. People have their own responsibility, their own life, their own will, but we can make help accessible. And we can make it available, and we can lower the threshold, as you said, make it easier for them to reach out, and maybe even go with them, offer that.
Okay.
Does it make any sense?
Oh, yeah. What I hear now is like they used all their energy or mental energy to reach out, and maybe that was the most of it, and doing the research.
And to survive.
Yeah, and also, to survive in the situation they are in. And you might help with doing some research, asking for help, and then provide what you have, because you had more chance for that. And also offer it with the attitude that these are choices that they might choose. So it's not that, okay, I did my work and you should go there because this is the best for you. I don't know. I also had youth in some crisis situation, and also addiction was involved. And there was a good rehabilitation center that worked for most, but for him, because of religious affiliations of that place, he felt like he would like to escape. And I don't know about that. So it's just an offer. The other thing is, what about calling 112 and paramedics, ambulance? If it's a super serious situation, it might be that help on the spot is needed. How can we think about that? How do you propose this thing? How do you think about this? How do you approach this?
From my job's perspective, what we do is that if a suicidal young person online is saying, I'm going to kill myself now, now, of course we call. In Finland, young adults and adults have the right to end their life if they want to. You can't automatically, against an adult person's will, say, I'm going to call help for you now, either you want it or not, and you have to do this. It's more problematical than that. I think people are in different state of minds when they try suicide. And this is not based on any research. This is based on my own experience. I have found that there are three different types of people who try suicide that are in three different states. One is hysterical. And when you have a hysterical person who is trying suicide, usually what I have come to notice is that their life situation has just become so overwhelming that they can't in that moment cope. And it's like it's a instant decision and it's an instant solution, and it's just like there's no thought behind it. It's I'm going to do this now, because if I don't, I will chicken out, and I can take this anymore. And it's really hysterical. In that situation, that person is not thinking clearly. And when a person is not thinking clearly, you have a bigger responsibility to get help for them, because they might not have done that choice if they would have been calmer. Another state that I find is also like a state where you really have to reach out is if a person is psychotic and is really not seeing reality for reality. The reality check is just not there. That then again, the person maybe wouldn't make that decision if they would perceive the world realistically. Those are two situations where I always call help. Like if I notice that the person I'm talking to is hysterical or psychotic, call help. But then we have the third group, and that's the calmest group you could ever talk to. And that's the person who really has thought about suicide for a long time, contemplated it, the pros, the cons, the when, the why, everything. And they have just come to terms with, this life is not for me. I don't want to live anymore. And that's a totally different type of suicidal person. And there's no hysteria and there's no delusion. There's just nothing left. If you're listening actively, that person really makes you stop. Like everything stops when you have a discussion with a person who has given up completely. Since an adult has their own right to end their life, usually those kind of chats are they just want somebody to know that this is it. They're not waiting for anybody to save them. They're not waiting for anybody to say, don't do it. You can't reach them anymore. That's a different kind of discussion. Of course, as a professional, my job is to try to get that person to see meaning in life. My job is to awaken hope in that person. But it doesn't work in the same way. It's really very different. And in those cases, when we're talking about adults, I don't have the alternative to call 911 or 112. It's their choice. So we're having a discussion about suicide, about life, and about death, and that's it. When we're talking about minors, it's a totally different game. Minors, we as adults have the responsibility to always try our very best to save their lives. And it's harsh because it's only like you're 17, you're a minor, you're 18, you're an adult, and it's there, it's a different thing. Then we have the young people who come and they are very suicidal, but there's hope and they are really torn. They don't know what they want. And if they give their information, their address and their phone number and their name, easy peasy, of course, we'll call help for them. Of course, no doubt about it. Mostly we try to get the young people to call help themselves.
Yeah, and it also gives them more agency. Thank you for adding this, like all of it, because there's a contradiction between being adult legally and also what we just referred to before, that our growing up, our neurological development is going on a bit longer. So that's why youth, for example, in the youth field, it's not only underaged people, but in their early 20s, they are still youth.
Yeah.
So it's not a black and white picture. The other thing that came up in my mind, I read and listened to John Hendon. He's a solution-focused practitioner in suicide prevention, and I really liked his approach about this trying to control people and stop them from killing themselves. It's a very understandable attitude, like, okay, I want them to live. But this can take over in a way, so it becomes a kind of, I don't want to call it game, but it's a kind of hide and seek type of game about who controls my life as a client. So they want to take over control, and they want to control everything. So they take away all the sharp objects. They don't want to meet me in where I am in this hardship. I'm not really listened to. I'm just treated as a child or someone who is incapable of doing stuff. And that might also push people to the other end of this continuum. Like, okay, I show you that I have my own will and I can do this. And this can push people to this in spite of them being a bit more open to talk about what's going on. Because if it's just about grabbing people and holding them down, it's not really helping them in where they are mentally or emotionally.
Yeah.
It's tough. And we are at the end of our time regarding youth and suicidal thoughts. Is there anything that you think there's a misconception or people should know about it, or there's a reminder about the topic?
Something that I tell some of because even though our chat is like it's a one-time service, you're supposed to come like one. You're welcome to come more than one times, but since we're anonymous, I'm not supposed to know who you are.
Mm-hmm.
Now we have so many young people coming, especially to the Finnish side. But sometimes we have these young people who come many times to the chat, like so many times that even though they don't give their names or anything, you notice and you remember them from the earlier times. And when we have those kind of young people that come, and I have discussed with them many times, and we talk about suicide and suicidal thoughts, one thing that I sometimes say is that I will have hope for you even when you don't hope yourself. And I think that's very important for us, to really believe that something can change for that young person who almost themselves have given up. We need to do better. That's our job.
I like this. It's a good reminder. Still, not just to these suicidal thoughts and these types of crises, but to other topics as well. I just wanted to ask you about what do you do about child safeguarding issues? So you talk to someone underage who brings up issues of maybe abuse or any kind of issue that's concerning from the child rights perspective as well, and something should be done regarding that. So what can you do about that?
When this happens, it happens a lot is to say too much, but it does happen. And when we get worried, well, again, now I'm saying the same thing as earlier, but believe the child when they say something, believe that it's true, and try to get more information, like in the chat. Try to understand and get a fuller picture of what's happening and how they perceive the situation themselves. We have to do everything openly. Like we can't have a discussion with this young person in the chat and then call child services. That's not okay. But what we can do is in the chat say, hey, I'm really worried about what's happening in your life right now. You're not supposed to go through this. This is not right. This is something that we really need to do something about. You need to be safe and you need to be taken care of and so on. What we have in our chat, even though we don't have any other knowledge, is that we have the IP address, which means that we know which IP that young person uses. And in very severe cases, we can give this address to the police and they will find out who uses this internet and they can track that person down in that way. So it's possible to find people that you don't have any other information about. But we do this openly and we always ask that young person to give their information and to give their permission because we want their permission. We want them to feel that they had a say in it and that and try to convince them that this is for their own good. And Child Protective Services, at least in Finland, has a very bad reputation, especially like kids and young people. They think that, okay, you call there, what happens is that police will come and take me away from my parents and I will never meet them again. That's like the misconception. I don't know anywhere else, but in Finland, it doesn't work that way. They're basically Child Protective Services tries every other way to make that family function before they take that child away from that family. So this is also a bit like educational work that we're doing when we're talking about young people who are in very, very hard situations.
So you want to have their permission and consent about this next step, and part of it could be also talking about what understanding they have about what's going to happen. Maybe they have misconceptions. They
Yes.
heard some stories. Yeah.
But even though if we don't get their permission, but the situation is so grave and so hard that we know we have the responsibility to take it forward, we inform them about it. We say, I'm really sorry that you feel the different way, but this is something that we have to do, and we're doing it for your own good. We're doing it to protect you. Usually that young person then says, fuck you, and goes offline. And we totally understand that. I honestly understand that. But that doesn't take away my responsibility as a professional to do something about something that is so severely wrong,
Oh, yeah. It's similar to implied consent with underage people when they are hurt. So when you provide first aid, you think, okay, the parents would say, please try to help them in spite of them saying, no, you don't help me. It's similar. And the last thing I wanted to get to is it can be tough to hear these stories and meet these situations. So what do you do to stay resilient and healthy? And also, what do you suggest to your volunteers? How do you keep your resilience?
Well, a lot of it is just concerning, basically taking care of yourself and finding meaning in your own life and taking care of your own mental health, doing things that are important for you, that make you feel good. If you're at least semi-whole person, you don't always have to be on top of your game and say that, oh, life is wonderful. It's not about that. But if you feel that you're a whole person and your needs are being met and you're in an okay place, then you have already quite a lot of resilience in yourself.
Mm-hmm.
And you should believe in that. If you feel that, okay, I had a chat, I had a discussion, I had a situation that really, really triggered me and made me feel very bad, and I don't really know what to do with this now, don't be alone with it. Like at least in our chat and our service, like we have these discussions after each chat with the volunteers if they choose so, if they want to themselves. And we just go through not specifically what the discussion was about. If they don't want to tell, that's not the main point. The main point is discussing how it made the volunteer feel and what it made the volunteer think. And just going through this with a professional and talking about and getting another point of view, or getting this comment that you did totally right, and this is not your responsibility, and so on. So these are the things that are really important to do, because otherwise you may start feeling that you're alone, and you are not alone. You're not, as a professional, you're not alone. As a young person, you're not alone. We suffer a lot from loneliness in many, many different ways. And our job is to not do that. Our job as professionals is to make young people see that they are not alone. First of all, they're not alone in that way, that many other young people go through similar things. It's more normal than they think. And the other part is they don't need to struggle on their own, because there is help, and there are people who really care, and there are people who want to help them. And the same thing concerns us professionals. We need to look after each other, and we really need to look after our volunteers. And if we want to talk about it broader, you need to take care of your friends, you need to take care of your family, you need to take care of your community. So just like bridging the gaps and really taking care of your social relationships.
I like it. And I like it that refers to everyone. And if someone is listening to us speaking to this conversation and gets curious about your work, where can they find you, and with what?
Probably easiest way to find me is per email. I answer that. It's my name, and sekasin.fi. And if anybody has any more questions, I would be happy to answer them.
Thank you very much for that. And are you open to any cooperation?
I hope my bosses are that we are on the same page here. But you can always ask. There's no harm in asking, and then we'll see what happens.
Okay. Let's go with that. I think it's good.
Let's go with that.
I just want to say thank you very much for all you shared. I can say that it helps our trainers and youth workers for sure.
Thank you so much. And there was so much more to say. I feel like we just opened the box and now we have to close it already. But yeah, maybe some of it would make some sense. And so thank you for having me. Thank you for a wonderful discussion and really good questions.
Thank you for listening to this episode of the podcast. If you found our work useful and inspiring, you can follow us by clicking on the links in the description. If you would like to support us, you can also do that by giving us feedback, recommending our work to others, or sending donations. As an NGO, we are grateful for any type of support. Take care, live well. We hope to see you again.